Hi, thanks for tuning in. So today, Democratic, independent, whatever candidate for the presidency, Bernie Sanders, has been soundly defeated in Michigan, Missouri, Mississippi, etc. Michigan being the big one that Bernie won in 2016, but lost now due to the coalescing of Democratic voters around a candidate with an extraordinary chance of success against Donald Trump. But let's talk about the COVID virus and the Trump administration's malevolent response to it. Because when a government is actively endangering the health of its own citizens, that should be talked about. So the New York Times has just broken a story, which I can't access because it's paywalled, but I can read to you from the Twitter feed from the journalist who broke it. He lies out some of what's happening. So somebody notes accurately that this should be a national scandal. The lives lost, the economic impacts, the disruption of day-to-day life, greatly exacerbated by inept leadership, courtesy of Trump. Now, we need to move beyond calling Trump inept when the level of harm carried out mindfully by US officials is so to the detriment of American citizens and is clearly far beyond mere incompetence or inadequacy. So we've already know of the whistleblower from the Department of DHS that sent workers to greet repatriated Americans from Wuhan in China at the Travis Air Base in California without adequate protective clothing or without training, knowing that those same workers would then go on and see migrants being held in Trump detention camps or concentration camps. So I'm going to go into the New York Times thread now. So for weeks, thousands of flu samples sat in Seattle as researchers sought to test and flag them for coronavirus. The CDC wouldn't allow it. When testing did happen, it was too late. The virus was upon us. So that's one of the most significant outbreaks in the US so far. Most of the people who've died in the 30 dead tally are from that nursing home in Seattle. So let's have a look. It's great that the New York Times is reporting on it. We as news consumers need to amplify this story. People need to know, and people need to start asking journalists to stop using the word inept, to at least introduce the possibility here that there is purposeful sabotage. It's a big idea, but at the same time, Trump's destroyed notes from his meetings with Putin. Trump lied about having a Moscow Trump Tower. It is not inconceivable that there is somebody in the Oval Office who is actively working to undermine American interests. So let's return to this story. Emails and interviews show that after weeks of CDC rejections, researchers in Seattle decided to defy regulators and test anyway. So there was no point at which the CDC said, okay, we're going to acquiesce to your requests to test these samples of this massive flu outbreak, serious flu outbreak in a Seattle nursing home. At no point did the CDC say, okay, we relent. The researchers defied the CDC to test the samples. So let's have a look at this extract from the story. A technician in the laboratory of Dr. Leah Starita, who is now going to be an American hero, who was testing samples, soon got a hit, i.e. for the COVID-19 virus. I'm like, oh my God, Dr. Starita said. I just took off running to the office of the study's program managers. We got one, she told them. What do we do? Members of the research group discussed the ethics of what to do next. What we were allowed to do was keep it to ourselves, Dr. Chu said. But what we felt like we needed to do was tell public health. So here we have the CDC actively working against researchers being able to identify a contagious disease with massive implications for American healthcare systems, the American people, and the American economy. So for those of you who haven't caught up yet with what's happening in Italy, they're having to erect tent hospitals in the car parks of their hospitals to have overflow intensive care units specifically to treat people who are requiring oxygenation as a result of severe manifestation of COVID-19. It doesn't affect everybody severely, but those whom it does impact have death rates as high as 8%. So if you're over 70 and you get this virus, you have an 8% chance of death. And that's high for an easily transmittable illness that the human population is naive to, meaning nobody's got any antibodies. This is not the flu. We all have some antibodies to various flu variants that we've got from exposure to the flu for years. This is a novel virus, and when it spreads, people are more likely to catch it, and then it's also not only highly contagious, but in terms of the severity of the extreme outcomes, they are very severe. They are deadly. Okay, so at that point, when the researchers had identified a positive case, by that point, we now know the virus had already spread undetected. 2 people had already died, and nursing home now linked to 19 deaths hadn't yet learned that their sickness troubles were coronavirus. We felt like we were sitting, waiting for the pandemic to emerge, say the researchers. We could help. We couldn't do anything. So maybe that's a typo. We couldn't help. We couldn't do anything. CDC officials. These are people under the instructions of a Trump appointee, Robert Redfield. CDC officials repeatedly said it would not be possible. If you want to use your test as a screening tool, you would have to check with FDA. Gail Langley, an officer at the CDC's National Center for Immunization and Respiratory Disease, wrote back in an email on Feb 16. But the FDA could not offer the approval because the lab was not certified as a clinical laboratory under regulations established by the Centers for Medicare and Medicaid Services, a process that could take months. So the CDC official, Gail Langley, redirected them to a process that could take months instead of expediting permission to test for coronavirus, novel coronavirus. Dr. Chu and Dr. Lindquist tried repeatedly to wrangle approval to use the Seattle flu study. The answers were always no. We felt like we were sitting, waiting for the pandemic to emerge. Oh, Dr. Chu said, we could help, we couldn't do anything. Okay, so they could help. The contrast is they could help, and yet they also couldn't do anything. The decision not to tap the existing flu study for monitoring was just one in a series of missed chances by the federal government during the early days of the outbreak when containment would have been easier. Tonight, there are 973 cases in 37 states. So that is very important. And people note, remember when Trump said he liked the numbers where they are? This is the greatest scandal in American history. I agree. Bar none, no exaggeration. The president's administration tried to hide a pandemic because he wanted the stock market to stay high because he wanted to get reelected. Or possibly wanted the virus to be first identified as being present in the migrant camps so that people could blame migrants. That's why they first exposed HHS workers to the virus by letting them go to the Travis Air Base in California without protective gear. They were trying to get on top of it and stifle the CDC's ability to test for cases in Seattle because they wanted to make it look like the virus was emerging from the migrants detained in Trump prison camps, where Trump donors who own those prisons are receiving millions of dollars in taxpayer money, $775 per night times thousands for at least 14,000 detained children, to say nothing of detained adults. And you have millions of dollars of public money being poured into the coffers of Trump donors, and Trump then trying to conceal and delay testing for the virus until they could produce the first cases from the camps. There was reporting recently that the immigration courts were instructed to take down signage on informing migrants on measures to take to best prevent the spread of coronavirus. And there was an outcry, and a few hours after it was reported on by the Miami Herald, the posters were ordered to be reinstituted, and they said it was a mistake. But I'm telling you now that this scandal may not be framed in this way by the media, but we need to start framing it in this way because there has been a concerted effort by the Trump administration to postpone identification of coronavirus cases until the cases that they had seeded with their own exposed staff, and the DHHS staff went to see migrants after meeting repatriated American citizens from the Diamond Princess and from flights coming from Wuhan in China. So we'll go to that whistleblower's report. There's a few articles that have been written about that whistleblower's account. Travis Air Base, which is in California. Travis Air Base, COVID-19. Okay, here's an NBC News article. So we can only piece this plot together because of a whistleblower with DHHS and these flu researchers in Seattle who persisted in testing for the coronavirus. Otherwise, it would have just been a lot of people dying in that nursing home and nobody identifying what was happening. So let's remove this from the Twitter stream, from this live stream, and then we put up the NBC article. I always like to source my assertions where possible. So here we have the coronavirus whistleblower. Feds helping evacuees lacked protection. Although the team had gloves at times and masks at times, they lacked adequate gear and received no training, a congressional office said. So Travis Air Force Base adjacent to Fairfield, California. So the key part that I'm trying to find in this article will be the fact that these workers, a dozen federal workers, are also people who would have interacted with detained migrants. So a government whistleblower has filed a complaint alleging that at least a dozen federal workers did not have the necessary protective gear or training. Now, if you're listening to this broadcast and anything about this seems implausible to you, put that in the comment section. If you're feeling gradually more persuaded as I explain it, then please resolve internally to take action. You can tweet out a link to this broadcast to any journalists you follow on Twitter. You can take, you could Google yourself the article, just type in whistleblower, COVID, DHHS, and you'll find any number of articles about this whistleblower. And tag journalists, go to their Twitter page and communicate with them. If they're not celebrities, they've got time to read a few messages. If you are watching this and you are concerned that this could have any element of truth to it, that the American government could have purposefully used its own officials as effective smallpox blankets to expose detained migrants to this severe and contagious type of bilateral pneumonia-inducing disease, to also expose the workers of those, the families of those DHHS workers to the disease and the communities of those DHHS workers, to purposefully induce an outbreak in America that could be blamed on migrants so that Trump could claim in his November campaign to be the only person tough enough on migrants to protect America from this or any subsequent outbreaks. So it hasn't worked out for Trump. There's been this whistleblower. Republican senators and congressmen are referring on their Twitter posts to the virus as the Wuhan virus or the China virus in an attempt to inflame any racist predispositions that people might have to just blame external groups rather than hold the government to account for its behavior. People have been calling the Trump government's response very incompetent. We have to look beyond that now and go to actively malevolent. They have to be suspected of active malevolence in this. So Pence claims we're initiating a full-scale investigation into the allegation. He's just hoping that nobody follows up with that or that they can do a whitewash investigation. I want journalists to follow up with asking how that investigation is going. So the complaint was first reported by the Washington Post, and contents were confirmed to the NBC News by the whistleblower's lawyer. The complaint says HHS. I'm going to note that lawyer's name, Ari Wilkenfeld. Ari Wilkenfeld, see if he's got a Twitter account and put these suppositions to him to say, is there any possibility that the government was using these employees as vectors to contaminate migrants for political gain. The workers had face-to-face contact with the returning passengers, and in some instances were close enough to the passengers that they handed out keys for room assignments and coloured ribbons for identification purposes. The complaint says staffers were improperly deployed and were not properly trained or equipped to operate in a public health emergency situation. Greeting Americans repatriated from Wuhan, China, in the middle of a massive, highly contagious disease outbreak. It's not incompetent to fail to train your staff, to deliberately deploy people and not speak a word to them of protocols in relation to highly contagious diseases such as this disease. Adding to the whistleblowers' concerns, the staff, I hadn't noticed this before, the staffers from the Centers for Disease Control and Prevention who were present were in full protective suits. Oh my God. So at the Travis Airport, CDC staff are wearing the hazmat suits, but the DHHS staff who will deal here with this and then go on to detention centers to interact with migrants are wearing nothing and are handing out keys and ribbons and things to evacuated Americans from this contagious area, from Wuhan, from the center of the outbreak, and looking uneasily around them and going, there are people in hazmat suits here. Why am I not in any protective clothing? Because you are a live smallpox blanket and your families are being used as live smallpox blankets to endanger migrants to prop up Donald Trump's hold on office, because that man faces a potential jail sentence if he's deposed from his position as president of the United States with a corrupt attorney general who perverts the law in order to keep him consequence-free from his many crimes and corrupt dealings. So under the Office of Special Counsel Procedures, lawyers will review the whistleblower's complaint and determine if there is a substantial likelihood of wrongdoing. These workers could have been vectors for the disease, could have been contagious without necessarily falling sick, but who's following up on this story? Who's following up with these workers? Jimmy Gomez from California said the whistleblower recently contacted his office alleging retaliation by higher-ups for having flagged safety issues. So they'll just try and pretend it's incompetence when that level of disregard for people's health, that some people were there, that CDC officials were there in hazmat suits. How corrupted has Trump made the CDC? This is extraordinary. So we're matching this article with the fact that it's now being, so this article is from, let's just check if there's anything else. Yes, Azar said he'd want to know the full facts, blah, blah, blah. If one of the HHS workers had become infected, then that person could have unwittingly infected others, Gomez says. Indeed. So migrants who've been in detention centers for a long time could have been passed this disease from workers. All right. Hopefully this should have been posted automatically to my Twitter feed. Okay, so we're taking this off the screen and we're sharing again the Twitter thread from a New York journalist who's reporting on this. So we're taking in combination now the fact that that HHS workers were sent improperly deployed to the Travis Air Base to greet repatriated Americans and may have potentially become infected. We need to look up that lawyer. So we're going to have a look live. We're going to look up that lawyer and see if he has an account on Twitter and if he's saying anything or if he's prepared to say anything about this combination of details, that the CDC were involved in actively holding back and delaying researchers who offered to test this severe flu outbreak because they were already conducting a pre-existing flu study, and they offered to run protocols to test these flu samples for COVID-19. And they were discouraged from doing that by the CDC when CDC officials were also standing at Travis Air Base wearing hazmat suits next to unprotected and untrained DHHS workers who were interacting, exchanging objects with Americans repatriated from Wuhan, the center of the outbreak in China. All right. So yes, we're just returning to quickly look at that. A series of missed chances by the federal government to ensure more widespread testing came during the early days of the outbreak when containment would have been more effective. So we had weeks of CDC rejections, and ultimately researchers in Seattle deciding to defy regulators, test anyway, and determining that there were samples of the COVID virus amongst the flu samples that they had collected. Okay, let's look and see if we can find Ari Feldman. He's a lawyer. Let's see if we can find him. This does not look like a lawyer is on Twitter. All right, that's okay. We'll do our own investigations off the internet to see if we can contact the lawyer for the whistleblower. I remember the lawyer for Christine Blasey Ford. Oh, look, here we go. Somebody's sharing my my broadcast now. Here we go. Thank you. All right. Stop sharing with the broadcast. All right, so let's go back to talking about this. This is huge. This is huge because we already know a lot of the conditions in those migrant detention facilities are very unhygienic. People are crowded in close proximity to each other. There was already scandals when we learned that children hadn't been supplied with soap or blankets and the lights were left on, so their sleep was very disturbed as well. And that multiple people had developed food poisoning as a consequence of eating improperly thawed or inadequately thawed burritos, and that the diets offered to the children were so limited that visiting nutritionists had to beg the camp directors to include a tablespoon of applesauce in the children's diet to give them anything approximating a fruit in their diet. So yes, Trump's election chances are slim because Joe Biden is such an appropriate candidate to choose. It means the various problems that happened in 2016, that residual sexism amongst Americans, particularly in more conservative rural states, involved the results of the popular vote being overturned. So Hillary Clinton won the primaries, had Bernie Sanders supporters who were being attacked with disinformation on Bernie Sanders' Facebook pages. And I learned about that today from Bernie Sanders, listening to an interview he did in 2018 with Vermont Radio. We can bring that up. Because listening to the sound of Bernie's own voice describe haltingly how people on his staff, a staffer named John Matters, noticed that there were a lot of accounts describing Hillary Clinton as a murderer, as the worst person ever in the world, on his Facebook supporters page, even after the primary had been lost, so in September. He makes another reference to it being April or May as well, when they determined that something weird was happening. But he did also very specifically make reference to September, John Matt saying, I think these are Russian accounts. These accounts attacking Hillary Clinton in a concentrated group of Bernie Sanders supporters on Bernie Sanders' Facebook page to call her a murderer and somebody who you should definitely stay home rather than vote for. And the interviewer asked him, did you go to the public? Because you could have, or we have a listener who's written in to say, Mr. Sanders, why didn't you go public with this? Because your supporters might have said otherwise that it was baloney. If Hillary Clinton said Russians were attacking her campaign and attacking her reputation, they might have said baloney, we don't care about that. But if they'd heard it from Bernie Sanders himself, they could potentially have taken that more seriously and then gone out and voted to protect their country from attack, from electoral attack of Russia damaging one candidate in order to elevate another candidate that would then be beholden to them for their help in getting them elected. And we now have Trump beholden to Russia after helping Trump get elected, as well as Trump potentially being millions of dollars in debt to Deutsche Bank with loans that are guaranteed by Russia. Something we'll probably hear more about if we ever get our hands on Trump's tax returns, which a lot of courts said we should. A lot of promises Trump has made in relation to volunteering his tax returns that he has not made good on. In the same way that Bernie Sanders has concealed his full medical records from people, even though it's known he suffered a heart attack, a common measure of heart health that would normally be released by someone in the interest of transparency following a heart attack, is your left ventricular ejection fraction, which is a measure of how much blood is pumped out of your left ventricle. So a measure of the capacity of your heart to squeeze, to contract and pump blood. And Sanders released letters from his doctor saying, oh no, he's good, he's pretty good, but not that number, which would tell people how significant the damage is to his heart. And certainly Bernie Sanders' occasional red-faced breathlessness after he's physically exerted himself speaks to why he's refused to release that number. And a lot of cardiovascular specialists have said it is an important number to release. So yes, lots of Bernie supporters did support Clinton, but when you consider the margin of Trump victory was 77,000 votes spread thinly across 3 battleground states in the context of the Electoral College, then you will know that every Bernie supporter they managed to persuade to stay home, every young man targeted by analyzing his Facebook data to find those who best fit a Machiavellian triage of narcissism and propensity for aggression. Those young men could be worked upon to say, here is a threat for you. Hillary Clinton is a threat, a murderer. You must fight her by voting for Trump or staying home and actively telling other people not to vote for her. You are now a warrior, a Machiavellian warrior for the cause. Then those vulnerable people, those psychologically vulnerable people, were identified and psychographically targeted with Russian interference, with Russian attacks conducted via Facebook. So people who identified as more vulnerable to bullshit, to Russian propaganda, were targeted with shadow ads that were made for their interests and made for their psychological weaknesses in their profile. So we're seeing it again. We're seeing Bernie supporters who still fit that Machiavellian triad of antisocial behavior, saying that they'd rather burn the country to the ground than vote for Joe Biden. So those people were weaponized by Russia and potentially by Israeli social media strategists as well, and Cambridge Analytica, which is a British company that worked to help Trump's campaign after helping Ted Cruz's campaign, and worked together with Russians. So I'm going to bring up that Bernie Sanders article. I know how to get it. I type in the headline, which is, "We knew what we knew when we knew it." Vermont Sanders. That's Vermont Radio, Bernie Sanders interview. And I know the point at which this interview becomes relevant to my accusations against Mr. Sanders. Click on the share audio button. So yes, if you are able to sit through approximately 2 minutes of listening to Bernie Sanders, then you will see what I'm talking about. So here's the article. It's from the 21st of February in 2018, so over 2 years ago, talking to a host, Jane Lindholm Wednesday, whom I'm indebted to for probing probing Sanders on these areas. Okay. So I need to scroll down to the link because there's a link that says listen to our full conversation here. But can you see this in writing? Have I shared this? Yes. But listening is probably easier than reading. Okay. Let's click the link to have a listen. During the interview, Lindholm asked Sanders why he did not warn his supporters of the suspicious activity. Okay, so I think I want minute 14.
And it turns out.
Why leave it at that? Why not? So because I mean, it was a specific question about why didn't you go to your supporters? So I'm curious.
Because we did not know early on.
In September,
okay.
Why
but
not?
She said, what was her point? That
so if you knew that Russian bots were promoting your campaign versus
I
Mrs.
did not
Clinton.
know that Russian bots were promoting my campaign. Russian bots were not promoting my campaign.
Let's leave that.
What we found out is that in April and May, it appeared that there were lots of strange things happening attacking Hillary Clinton.
So let's take support out of it, because I think support is a charged word. But if you and your campaign knew that there was Russian meddling and that it was trying to sow divisions, why not take that directly to your supporters, many of whom really, I mean, hung on your every word, as you know.
Well, I would say that the real question to be asked is what was the Clinton campaign? They had more information about this than we did. And at this point, we were working with them. So I think the proper question is...
So did the Clinton campaign say, don't talk about this?
No, of course not. I mean, but who do you think would be raising that issue?
Well, I could see a world in which Mrs. Clinton said, it's the Russians, and people and Sanders supporters say, oh, that's baloney. But if Sanders says it, they say, okay.
We knew what we knew when we knew it, and that's about all that I can say.
And before we totally leave the topic of guns, which we will double back to here for a moment, let's go to Robert, who's calling in from Burlington. Hi, Robert. Go right ahead.
So how was the audio on that? Dr. Fiona Hill, Michael Durkin is pointing out, told us on 60 Minutes that Sanders is part of Putin's plan to polarize us. She's right. The question is, how much damage can Bernie Sanders supporters do, given that he is an aging man with a recent history of a heart attack and a massive rejection from the Democratic base, with Michigan, Missouri, Texas, so many states having an overwhelming number of voters voting for Joe Biden in a way that diminishes the early lead that Sanders took when people thought, oh, yep, he seems like he's the front runner. And he derived votes from that narrative of, look, here's the front runner, ignoring the fact that the initial states in the primary race were Iowa and New Hampshire, which don't have a significant Black population at all. They're 91% white, approximately. Once people saw the South Carolina results and realized the extent of Black support for Joe Biden, that resuscitated his campaign, evaporated the negative story about Joe Biden, and coalesced Democratic support around his candidacy. So white people stopped discounting the fact that Bernie Sanders didn't have very much support at all with Black voters over 30. And older voters are the more reliable people for turning out to vote in elections. Young people have increased their demographic share of turnout. So the proportion of young people who turn out to vote now has gone as high as 36%. That's the ceiling for young voters under is it under 35? I think under 35, ceiling of 36% of those people. Whereas for older people, they've slightly increased their turnout to, guess what, 66%. So 66% of people over 40 or something turn out to vote. They are the backbone of an election, and they're spread across every state, and they're in all of the battleground states. They're not just concentrated in hip states like California. They are the backbone of any electoral college strategy. All right, gotta go.